So this patient's coming in for a rapidly expanding lesion on the angle of his jaw. He actually has a posterior cyst here. You can see that's we're going to have to leave alone for now. This one's gotten secondarily infected. What we're going to try and do is inject some freezing along this side. With these, we try to incise them along the lower end of the angle of the jaw, if you can see through here, because when it heals, if he has any scarring potential, it's less likely to notice it. So again, the problems we'll have here, this is an infected field, so anesthetic may not work as well. I'm going to feel a poke here. So we want to be very superficial. Little poke here, I apologize. I feel it burning. So I'm trying to barely be in here. Ideally, I want to see this swell up a bit more. And the reason I'm trying to be so superficial, because as soon as you get into the cyst cavity, that swells on him and hurts. Yeah. So he's being pretty stoic right now, but see how that swells? That's certainly uncomfortable. Just breathe as best you can. Good job. Does that hurt when I do that?
No.
No pain then. This is our number 11 blade here. You okay there?
Ow.
So I'm going to try and add a little bit more freezing before I extend that. Okay. So this is what we expect. This is all pus, obviously. You can see how that deflated. So again, when I push up here, he's obviously going to have some discomfort, but to do a circumferential block all around the infected area is really quite uncomfortable. So it's about finding a balance where we don't want him to be excessively uncomfortable, but not causing excessive pain either. So I'm just going to use this curette so we can break down adhesion. We have to do this gently as well. Does that hurt when I do that?
Nope.
And as we do that, you'll see it oozes a bit more.
Oh.
A bit sensitive there. Irrigate this. This is kind of a weird sensation. You okay? So this serves two purposes beyond cleaning it out. It also breaks down extravoculations. So if you're watching this and worried about sterility, again, when it's an infected field like this, we don't worry so much about sterility. So if this doesn't have to be injected in one consistent effort. So once I've cleaned that out enough, so now I want to try and swab and try and see if we can find any active bacteria. So not pus, but actual. You okay there?
Yeah.
I'm gonna send that off to the lab. Then the issue becomes one of, do we need to pack this? So we only pack for two reasons. One, if I think there's extra loculations that need to break down, or if it's just bleeding excessively. This, from a hemostatic perspective, looks pretty good. So we're just gonna put a dressing on this, and then we'll clean that up, and then sort of go from there. That's it.